My name is Rebecca Overbury. I am an associate professor. I work in both the Department of Pediatrics in the Division of Pediatric Rheumatology and in the Department of Internal Medicine in the Division of Rheumatology. So, our research is funded by the Primary Children's Hospital Foundation Early Career Development Award, in addition to the CTSI voucher program. I am working with the University of Utah, Intermountain Health, Primary Children's Hospital, and the Utah Population Database in order to collect data on patients within the state of Utah who have childhood onset rheumatic disease. And we are interested in understanding the transition experience as well as long-term outcomes. So, by the transition experience, I'm referring to whether patients make it to an adult rheumatologist, whether they make it there in a timely fashion, and whether there are any adverse medical events along the way. Regarding long-term outcomes, what we want to understand is whether this patient population suffers any comorbidities or even mortality that could be associated with poorly controlled rheumatic disease. So this could include diagnoses such as mental health conditions, obstetrical complications, end-stage joint disease that might require a joint replacement, or end-stage renal disease that might require dialysis or transplant, or some major adverse cardiac events. And by gathering this data, we aim to understand where our current gaps are in caring for this vulnerable patient population, and then moving forward, hopefully close those gaps. So I believe that this research has the possibility to help the world in the sense that the data that we will gather from this research project is going to be the largest cohort of its kind, first. And secondly, it will be data that won't be completely translatable, but will help us understand the larger issue. To interpret this data, of course, is where you're going to find the meaning and the value and be able to move things forward. So that interpretation, it takes skill, it takes teamwork, it takes time, it takes money. So I would not have been able to anticipate taking this research project to the conclusions that I'm now hopeful we'll be able to reach without this additional funding that we got through the voucher program. I would strongly encourage anyone who needs support from the CTSI to consider applying for this program. It's been for us a wonderful resource.